Hi, Kate. Can you tell us about your role with the Down Syndrome Association?
In my role, I oversee the Down Syndrome Association DSA Active and Disengage programs. The programs highlight the importance of taking part in physical activity for both good physical and mental health. DSA Active recognises that good physical and mental health are important for absolutely everyone, and they're interlinked and impact on our general well-being. So taking part in any activity, whether it's physical, sporting, or another sort of recreational activity, can benefit the physical and mental health and therefore well-being of everyone involved. And this is no less true for children and adults who have Down syndrome. DS Active supports successful inclusion in leisure, recreational and sporting activities at all levels of ability, from local community participation through to national and international level participation. And I work with those activity providers to enable the successful participation of people who have Down syndrome.
But I wondered if you can share some of your thoughts about inclusion in PE lessons across the age range.
I think it's very important from a young age that all children have a positive experience of taking part in physical activity, and so that it helps create a positive lifelong relationship with taking part in any sort of physical activity or sport. And a can-do attitude to being active in sport needs to be introduced at an early age. And so PE lessons are really, really important because for some children, they are the first experience of regular physical activity. So it's important that teachers and school staff approach PE lessons in the same way that they do other areas of the curriculum, seeing that each child in the class is an individual with individual strengths, with challenges, and that includes any child, and includes those who have Down syndrome. So the teacher will know all the children really well and will differentiate tasks and activities in PE for all the children as necessary and appropriate. And, whatever the PE curriculum focuses on for a specific term, there'll always be a wide range of ability within a class for that focused area. Those who excel, those of average ability, and those who find it a challenge. And if we take something like hand-eye coordination as an example and throwing and catching activities are used, there'll be a huge range of ability within a class. And a child who has Down syndrome could be in any one of those three groups that I mentioned. And the teacher is going to be aware of that and differentiate as required across all the abilities in the class. So, the teacher, through a process of ongoing assessment, will see children's abilities, will differentiate appropriately, and that will enable everyone to successfully participate, including the child who has Down syndrome, and ultimately then their skills will improve over time within their PE lessons. And then as a child progresses on through school, there can also be opportunity to explore other options within PE and games lessons. So, within high school, as the rules of sports and games are looked at and learned more thoroughly, and the effect of physical exercise and activity is explored, there are opportunities to get involved in learning skills and knowledge that are needed, for example, to be a referee or coach, as well as to explore wider topic of health, fitness, nutrition and well-being. And these topics will often overlap with other subject areas.
Please, can you tell us about the work of DS Active with activity providers and sports providers?
Overseeing the Down Syndrome Association DS Active programme, I work with a wide variety of groups of people and local and national partner organisations from individuals who have Down syndrome, their families and carers, through to sports national governing bodies. And DSA Active works with and supports a range of activity and sports providers to ensure that children and adults who have Down syndrome can successfully participate and be included in the activity or sport that they're interested in. So activity and sports providers approach the Down Syndrome Association for our expert knowledge and support regarding Down syndrome when they have a participant who has Down syndrome wishing to join, or that they may already be taking part. And providers who approach us are always very keen to ensure that they're doing all they can to facilitate successful participation and inclusion. And we work with them to ensure that they're confident in using the expert knowledge that they have about their activity area or sport, alongside the support that we can provide. The support that the Down Syndrome Association provides starts with our bespoke DSA Active online training, which provides a unique opportunity for people involved in running sessions to learn more about Down syndrome and to use that knowledge to support their own expert knowledge that they have about their activity or sport in order to enable a successful participation and inclusion as possible. We also support with funding, as well as supporting through access to our very popular and successful social media platforms. Activity and sports sessions can also benefit from the work of our affiliated groups liaison, who I work with on behalf then of session providers, for example, to support and increase participation in weekly sessions or to promote special events. Our activity and sports provider partners are aware that the Down Syndrome Association is very much involved in ongoing policy work and collaboration with organisations that are within local communities that are national and international, such as NHS England, the UK and devolved governments, and national and international sports governing bodies. And we work with them to ensure that the importance of good physical and mental health and well-being for everyone, including children and adults who have Down syndrome, is understood and translates through to policy and practice that is being put in place. We've recently collaborated very successfully with the English FA to update and improve their disability awareness CPD information for their coaches, and we know that this will be an invaluable resource, as it not only serves as a source of information about Down syndrome, but also reminds coaches that they already have the coaching skills required to provide great sessions for children and adults who have Down syndrome. And the Down Syndrome Association and DSA Active also receive many different activity-related queries. We're always very happy to signpost or assist further with specific queries that individuals who have Down syndrome, their families, or specific organisations might have. And I strongly believe that with effective communication and collaboration, both children and adults can very successfully participate and be fully included in any activity that they enjoy taking part in.